Hello. So today for my presentation, I'm going to be speaking on menopause. Menopause is basically where women between the ages of 45 and 50 are out of their fertility stage, we're having children, and they enter the change, the next phase of life, basically. Working at OBGYN for a total 8+ years, I've come across a lot of patients with different problems with menopause. Now, not all patients are going to have issues. Menopause basically is personalized and sculpt around that person. So, well, I should say that woman. So it's not just because your mom may have had hot flashes does not mean you're going to have them. Just because your mom may have been irritable does not mean you're going to have that issue. Again, it's very personalized. So some women have a lot of bleeding. Some women have a lot of problems when it comes to entering that next phase. And there are non-hormonal and hormonal medication, birth control that's out there for patients that don't want to go to the surgical route. Now, you have some patients that have no choice but to. Um, so with those patients, we, depending on age, now a lot of times, women maybe early on, no, they don't want children. So a hysterectomy is something that they're okay with. Then you have women that are maybe not in that 45 to 50 age range and they're younger. They're still in their um fertile stage, age 40. Um Younger than that, 30s, and they haven't had that option to have children, and knowing that that option is going to be taken away from them is where we kind of look at them as fragile, because they're probably stressed, they're probably going through something. It's probably a battle with them trying to figure out what other options there are to fix the situation they're in with their menopause without having to take away their option or womanhood of being able to have children. And then we have patients that don't have any issues. They don't have the night sweats or the the hot flashes, the irritability, the depression, anxiety, just everything else that comes with going into that next phase of life. And those patients are easy. They come in, they don't have any issues, and they leave. And we have some patients that, again, like I said, have that heavy bleeding. And it's not just a cycle, it's abnormal. And it goes on for days, weeks, months, even years. And that's when we have to look at different, not as invasive but still a surgery type option where you have a mild shore, sorry, a mild shore or a NovaSure, which burns the lining of the uterus, which thins it out so it's not as much bleeding, and then that patient is put on a non-hormonal um, medication, or cream or gel or even a suppository, that can help with their um, whatever issue they're going through with that. So there's a lot of options out there. Some people don't know. Some women have already talked to their mom and grandmother and they know their family history. They know what's hereditary, what's genetics, what is just personalized to them because of how their body goes through whatever it goes through and how their body handles certain problems or illnesses that may come up with them. So it just really depends on that person. But a lot of women they talk about menopause as like the worst thing that can ever happen. I personally don't think it's the worst thing that could ever happen. I know I agree it can be frustrating knowing that you're having to go through another phase of a change and not knowing how it's going to affect you, what it's going to be like, how it's going to affect your family and yourself. So I can see how that can be frustrating. But again, sit down, talk to your OBGYN, know what options are out there, talk to your family. Getting family history is really a big thing because if you know that, okay, grandma has polyps or fibroids. Mom had fibroids. Great grandma had fibroids. So that means most likely around the age that they started having it, you may have it. So getting family history is always important. And then once you know that, you know what your body, you know how, it handles certain things and situations that may come up, then that's something good to talk to your OBGYN. And you don't necessarily have to be going through menopause to talk to them. You can talk to them now, in your 20s and your 30s, just so you can kind of have a clue. Okay, well, if I don't have children now, do I want children? What other options are out there? If I'm not able to have children, or just whatever that is going to basically inform you and educate yourself on that next stage, what it possibly can bring, the good, the bad, and the ugly, honestly. And, I just tell patients, educate yourself, read, don't Google stuff, anything. Don't Google. Google's going to tell you have cancer, and you're going through menopause. It's not cancer. They're going to say your big toe's going to get cut off. That's not going to happen. So I just say, educate yourself, women. Don't always believe what Google says. Don't always go by what your family has gone through. Always listen and learn, but you know your body, you know yourself. So, it's just the next phase of life, and well, it's things out there that can help you get through it, and you'll be fine. So, in conclusion, I just want to state that, menopause is not the worst thing in the world. There's things worse than that. But as long as you educate yourself, you know how to get through certain situations when it comes to your health, then you should be fine. And talk to your OBGYN. They'll be able to educate you on things you may not know of, and try to help you. All right? Have a good night.